Many times when families call, they want to know what their addicted loved one is using, whether it be drugs or alcohol, how much, how little, etc. At the end of the day, it doesn't matter. Certainly, people on heroin are higher risk for overdose and death. That's an issue. Certainly, people on alcohol have a higher risk of fatal car accidents. People who are on meth have a greater risk of course, doing some crazy things because they're on psychosis. So in that regard, it matters. But behaviorally, it doesn't. A lot of families before the intervention will call us and say that the addict or alcoholic's been on their best behavior. They haven't used drugs or they haven't drank in a few days. And they think that the problem's potentially going away or they don't need us. The truth is that they're just resting up for their next run. The problem isn't the drugs or the alcohol, the problem's their behaviors. Anyone that's called us and said their loved one hasn't drank or drug in a couple days has inevitably called back within 2 weeks saying they're now worse than they were. It's not about what they use, how often, how little, how much. It's about what they're doing or not doing as a result. The point is just abstinence alone doesn't change the behaviors. And families want to believe that the sheer willpower of abstinence is enough to maybe put the intervention off or think that they've turned a corner. We've never seen anybody who's a true addict or alcoholic who's addicted to substances just stop on their own willpower and then maintain that. Addiction is not about the drug or the alcohol use. It's about the behaviors that lead up to it.